Sudan is going in a very difficult time and situation. It is not only connected with the effects of the coronavirus, which is affecting Sudan very large, and it is not only the problem of poor health system in Sudan, but generally the problems, the general problems, the political and social problem in Sudan. Sudan was suffering from dictatorship for more than 30 years, and from continuous civil war continuing from 1954. So all this affected Sudan very bad. The country have been divided to two pieces in 2011, and many families have been separated. Many people have been separated into the two countries. I think this also, India suffered from this after the independence and the separation of Pakistan from India. So this affected people and the social situation and the mental health very much, because many people found themselves as refugees in the other part of the country, and with a lot of legal problems, with a lot of social problems, with a lot of economical problems. Also, the war which was undergoing in Sudan for almost all post-independence period has affected people, because we have a lot of refugees, we have a lot of displaced people inside Sudan. Sudan has lost in South Sudan more than 2 million people. In Darfur, it is almost 500,000 people. And we have the biggest amount of refugees from Sudan outside the country, and inside the country also from other countries. We have more than 1 million refugees, in a country counted like 40 million people. Also, the economical situation and the degradation of life and of social life, this has affected the general health situation, and especially mental health. So also the very poor situation of the health system in Sudan. Health system in Sudan was concentrated in the capital and big cities. And this was doing fine in the years after the independence, where we had only a population of 16 million. But after the increase of the population, especially in Khartoum city and in Khartoum province, where now about more than 7 or 8 million people are living, the health system collapsed in Sudan, and now we can't say that the health system is working, and especially the mental health system is not working well. Of course, Sudan have been supported by the UN and by the World Health Organization and by different organizations to recover its health system, and also to provide some policies on mental health. You kindly provided this in your paper, and also I talk about this in my last speech, so I don't want to repeat it. But all this is connected with Sudan recovering politically and economically. Because while we have a crisis, while we have an economic crisis, while we have a political crisis, where many people, they don't feel secure, they don't feel safe in the country, where many people are suffering to get their like bread for their children, people will not have a good mental health. The good side that in Sudan, because Sudan mostly is a Muslim country and suicide is forbidden by Islam, So we don't have a lot of suicide situations, but we have a lot of like uncontrolled mental disease and unhealed mental disease. Many people in Sudan, they suffer from mental disease. Last time I read an article and a report that maybe 40% of the Sudanese population is suffering from different types of depression. So it is almost the half of the population are feeling depressed because of the situation in Sudan. The bad side that we had a revolution and we have a transitional government last year, and the civil government began to work from October last year. So now we have like 1 year, but almost all this year the country suffered from COVID-19, and COVID-19 made the situation worse because all resources have been allocated to fight COVID-19, and almost all mental health clinics were shut down. So there is no care about people who are suffering from strong mental health diseases and strong mental health after disease situation. These people, they need very long time of rehabilitation. Also, we don't have enough rehabilitation process or clinics, and there is of course some organization working on the field, non-governmental organization, but they are very small, and also they have a problem of financing, of funding. So many of these organizations now under COVID-19, they just shifted from mental health problems to general health problems. I think Sudan after COVID-19 will need a very strong mental health program. Here all internal resources, regional resources from Africa, and also international resources should be allocated and should be available for Sudan. Also, we look forward to get from the experience of countries which have similar socio-political situation, getting out of from dictatorship and from civil war. And we have some good examples in Africa, like in South Africa. We have a very good example of mental health policies and mental health reforms. Also, we'd like to get also from the experience of India and other democratic countries of the South, like Brazil, Argentina, and other countries. Morocco also as an African country, Ghana, they have very developed mental health programs, and we look forward to get from their experience, because mental health problems in Africa, they are radically different than mental health problems in the West, like in USA or in Europe. So also gaining experience, we will look forward to the countries of the South, different from Asia, from Africa, and from South America. That is generally what I did. I waited for people who are really working in mental health to join us today, but it seems that they couldn't make it. So I give the floor to you. Thank you very much.
Great, sir. Sir, I just want to, before Soma ma'am explains you what research we have done, could you just explain me this line, mental health problems in Africa are radically different than what people experience in the Western countries? What do you mean by this?
I mean that the causes of, in European countries or in the West generally, We have a very well-established health system and mental health procedures, mental health, policies. In Africa, we lack all of this. Still in Africa, there is a stigma of mental health problems. People are afraid to go or to declare that they have mental health problems. So this is different than the West, where people, they go to the normally without feeling a lot of discrimination. Also, in Africa, we have many people, like in Sudan, who go to their religious or spiritual leaders for help when they suffer mental health. Not every time these people are qualified or experienced with mental health, and sometimes the situation get worse. I can say that in most of the situation, these people who go to spiritual or religious leaders, they are imprisoned, they are kept in very unhealthy conditions, chained and beaten, with this they have devils in them, or Satan, and they have to get this Satan. So the approach is not scientific. The approach is quite metaphysical. So this one of the problems. Of course, also I said about society, that people, they don't kill themselves, but they live in misery and they live in the streets, and they are subject to different kind of abuses. Women with mental health problems, they are subject to a lot of sexual abuse, because even they can't protect themselves. I remember a very sad situation in my town. A woman with mental health who was living in the streets. We were living in like in the bazaar, in the market, and she was a mother of 9, and she did not know who were the fathers. All these 9 children who were after that, also they had mental health problems, and many of them died when they were small, were results of rape. So these are the problems. We are very like basic primitive problems which we are still facing. That is the difference.
Soma ma'am, please go ahead and explain the the mental health reforms which are there in Sudan, and how we can move forward with Sudan, so that sir knows that what we are planning.
Before all, we have to restore mental health clinics in the hospitals, because now they are closed. In Khartoum, they are closed because of coronavirus, and in small cities, they were closed because of lack of resources, lack of doctors, lack of beds, lack of medicine. So many of mental health clinics inside general hospitals, they were closed, they were shut down. So this is the first step, that we have to restore mental health services in the mental health system in Sudan. Also, we have to put policies, very detailed policies about mental health, about the ethics of the mental health in Sudan, about the right of the people affected by mental health in Sudan, because in the general conscious, in the general knowledge, the people, they don't know that people affected by mental health, they are human beings, and they have their own rights as citizens and as people affected. And in many cases, these people are forced for different kind of treatments which are not suitable for them, and even they don't have the right to refuse or to choose the type of treatment. So also this is one of the main problems, that the policies should be very clear, they should be very detailed, they should be regulated by law and not by local regulations or just regulations in the hospitals. Also, we have to work on the social conscious of the people to fight the stigma about the mental health, and to explain that mental diseases are normal diseases, they are just like other diseases, and they can be helped, and they are not connected with people being possessed by devil or by bad spirits or by Satan or something like that, because this will not help really in in healing the people. If you don't know the real causes of the mental health problems, you can't heal them. Also, we have to make some kind of rehabilitation and restoring of the system of education. Sudan now is, we have a lot of universities, but these universities, they have a very, very poor curriculum, and they have a very poor financial conditions, and also they don't have the experience like lecturers and professors, because many of our experienced doctors have immigrated, unfortunately, from Sudan to Gulf countries, to European countries, because situation in Sudan for doctors is not good. So also caring about doctors, caring about mental health manpower is very important. These are the main elements. They are basic elements which we can work on, and of course it needs resources. And yeah, today I read that the Ministry of Health in the state of Khartoum, one of the biggest states, most populated, they ask non-governmental organization to pay for their staff. So this shows us how the situation and the lack of resources in Sudan, and the need for immediate help from the international community with this COVID-19 and after COVID-19 time.
Soma ma'am, please.
So actually, sir has covered quite a number of points already as far as the problems that are there in Sudan. So we also we did a lot of the research, and as sir has already mentioned that, there is a great need to develop the mental health facilities, like the staff and the treatment and the living facilities that are provided. There's besides this, there's very poor data collection of the users over there who are who are there in the outpatient facilities. So that needs to be strengthened, the data collection, so that, one can do a lot more in this area, be more, have come up with concrete solutions. Then there is also, there is no follow-up also in the community by the outpatient facilities, or there are also no mental health mobile facilities which can reach out to such patients once they have moved out of the system. Then, as sir has already mentioned, that it's basically in and around the capital area. So, the rest of the country, rural areas or other cities, smaller cities, there is very little mental health to see. So now, the other thing that one would like to bring up is the staff training, which sir has also mentioned, that there is the curriculum, the education system is, the level of that is quite poor. And that is one of the biggest hurdles, because if you don't have good staff, you don't have good doctors, you really can't make any kind of an impact in the mental health area. So that really needs to be looked at, because very little training is also given to people like the nurses. Also, there was a study by WHO in 2008 where none of the nurses who had graduated in 2008 had been given any kind of psychiatric training, and only 0.05 psychiatrists per 100,000 had only about 1 year of training in this area. So that certainly is not something that I mean, that is certainly something we really need to address. Now, besides that, of course, you've spoken about the cultural barriers, which are very prevalent, and number of them gravitate towards traditional healers. Or also because there's so much of stigma as to when you know that this is a hospital, which means a mental hospital. So a lot of people don't go there because of the stigma. So in fact, there was some healthcare workers who had also mentioned that if you remove the uh, word psychiatric hospital, it would make a lot more difference, because then you just think, okay, you're going to one hospital, and people don't associate it with somebody having a mental issue. It's just like a general hospital, and people are going there. Um, so that is one thing that we need to build up awareness, and amongst the people, and try and address the stigma over there. Then also there is the medication that is available, that is also quite costly, and it's only theoretically free in areas in and around the capital only. So that is also a deterrent for people seeking medical help in such cases. And there are also no social insurance schemes, because if you had these kind of schemes, it would really help in people, at least it would make it more the medication would be more accessible then. Um, then I would also, as far as from the healthcare providers and policymakers, that the very little budget allocation is given to healthcare. And from approximately only 4.3% of the entire your GDP is going for health care. And out of that, how much is being spent on mental health is, we don't have the figures for that. We don't know how much is being done. So as it is, 4.3% is so small that doubtful that mental health would be any significant number. We have very inadequate staff. There is also a lot of social criticism and personal and professional impact, because anybody associated with any kind of mental health is automatically also professionally ostracized as well. So it makes a lot more it becomes tenfold, the problem becomes tenfold. Then there people also have certain worries about the side effects or the addiction to such medication. So that could also be a reason why people would not choose to go for this and move towards the traditional healers, because culturally also they probably have far more faith in traditional healers than in the medical side of it. So there was one apparently mental health policy which was revised in 2008. So according to this, which they had proposed to develop the mental health in primary health care, and to increase the human resources over there. They also wanted to have users and the family involvement, because that was also lacking. So if the family is also involved in this, it would it would, benefit both the user and the family, because they both have to deal with the situation. Then human rights, which is essential, because one forgets that even these people, as you have rightly mentioned, that these people also have rights, and we have to ensure that their human rights are protected. Then we have there is a great need for a monitoring system, because once if somebody is entering the system to for treatment, then follow-up treatments, follow-up monitoring of that person, that is essential, and that is lacking. I think that's where if we have these mobile vans or these outpatient facilities where constant monitoring happens of the users and the family members, it would be really helpful. There's also a Mental Health Act which was drafted and was awaiting approval in the Parliament, which was basically looking at access to care and rights of the mental health of the consumers, family, caregivers, the competency, capacity, and guardianship issues for people with mental health, and voluntary and involuntary treatment where human rights come in. It's that is also one of the things waiting for approval. Then law enforcement and judicial system issues for people with mental health, that also needs to be. I can go into a lot more details if. How do you want it, Professor Nabit?
Also, there is a point which I want to add with Soma ma'am. Sir, this document, I will send it to you, what research and recommendations Soma ma'am has said. Even when I was checking the country profile under WHO, they do not have anything specific relating to mental health. I mean, that block was completely empty. I don't know whether everybody else will agree to that, but when we were checking the WHO status with mental health in Sudan, there was nothing mentioned there. Plus, they haven't revised the act, which Soma ma'am was also saying.
Yeah.
So, as a first step, sitting in different parts of the world, different states, how can we? I mean, we will draft this document. What recommendations you have given and what recommendations ma'am has also given, and whatever we feel, I'll send it to you. Um, do you want us to first, I mean, how do you want us to step in with your ministry or with WHO? I mean, how do you want us to go ahead to pitch in that about the mental health issues specifically in Sudan? What do you have to say about that, so that we prepare something very concrete for that?
Okay. I think that we have to address Sudan authorities before all. As the previous speaker informed, that there was a parliamentary group working on mental health, but unfortunately, since April 2019, we don't have a parliament in Sudan. We don't have any kind of, popular representative of the people. So, many we don't have the constitutional court working. We don't have a lot of institution, they just ceases to work, and they have not been replaced by any new institutions. So also there is this institutional problem. But of course, we have our federal Ministry of Health, and we have our regional Ministry of Health. In Sudan, we have 18 regions, and every region, they have their own Ministry of Health. So we have to address the Federal Ministry of Health. We have access to them. In fact, the minister himself is very interested, but of course, the lack of resources. Also, we have to address the Minister of Health of the state of Khartoum, the biggest one, and other state, regional state ministries of health. Of course, we can provide also to the World Health Organization our research, so they can update, because really we don't have good data collection in Sudan, and we have problem with the statistics. They are very old. They are not updated because of the lack of the resources, because of the lack of the institutions. So this is also one of the, of course, we should work with the community of doctors, or physicians, of psychiatrics who are working on this field, because they are the people who can implement these policies, and they can make some change, and they can make also pressure to implement the recommendations, or the good practices. Also, we can contact the local or traditional leaders, because although the situation is very bad, but there were good examples where there was cooperation between doctors and traditional or religious leaders in their respected areas, and the doctors were visiting these facilities carried by traditional healers, or traditional or religious healers. So there was some kind of cooperation. Myself, while touring Sudan in different places, I visited a lot of these religious leaders, or the traditional healers, and I talked to them that they should cooperate with official health system. And many of them, especially the young ones, they agreed. And they said that they are doing this because there is no mental health system in their areas, in their respected regions. So somebody should do the work. So they are doing it. But sometimes even they are not happy that they are doing it, because just his father or grandfather was doing it. So people are coming to them, and they can't leave them without any kind of help or assistance. So also this segment of we can say health workers should be addressed, and some kind of programs, training programs to them should be provided, so they can make the difference between people who are really having serious health problems, should be sent to doctors, and other people who need some kind of spiritual help or assistance, because also in a country in Sudan, this spiritual factor plays some kind of role. So they can go, of course, nobody will prevent anybody from going to get some spiritual help, or spiritual assistance, or spiritual, or some kind of prayers. But this could not be the main solution for the problem. So also these people, these leaders, these healers, traditional ones, religious one, should be addressed in a very firm way, in a very clear way, that they can help, but they cannot be a substitute for official and professional health system.
So, sir, after I have just this thing in mind, Soma ma'am, if you agree, and everybody else, after sending you the documentation with recommendations and the research which we have done, I will also send it to the board of advisor, which we have slowly been appointing on board. The best part is the UN Assistant Secretary General is on our board of advisors for mental health. So he will actually be a very good help to us. In the meanwhile, when there is pandemic and coronavirus, can with your cooperation and facilitation, can we tie up with any one Ministry of Health, and we can start giving online trainings to caregivers?
Of course, we can address the Minister of Health about this, and we propose online training. And also, I would contact some of the medical association, mental health associations, especially, and propose them that you can provide some kind of training, at least on the side of policies, institutional reforms, This could be done online. Of course, we are not talking about training for doctors or for nurses, because this is something it needs more resources and it needs to be on the ground. But for policy makers, for staff of the ministry, for people working on non-governmental organization, we can provide some training. Also, I can contact political parties and political leaders because, as I said in my previous speech last time, that in Sudan we have a very narrow or lack of knowledge about the mental health problems within the political circles. So I will contact the leaders of political parties in Sudan, and especially parties who care about the health problems, and they have certain programs to deal with it, because not all of the political parties in Sudan even developed their programs. We have many parties which they don't have program at all, written program. So I will contact them. I will provide the papers which we can develop, the recommendation, the research which have been done, and of course it should be translated also into Arabic to make it wide available, and of course these people also can have some kind of influence on the health and the mental health sector. Also, we have the highest committee, highest health committee now, organized mainly to fight against COVID-19, but also they could be addressed because they are supervising the everyday health work in Sudan, on the federal level and on local level. They have quite good resources, and many of their members are quite qualified. So also we can talk to them, and we can provide our solutions, our recommendation to them.
Great, sir.
Sorry.
Yes, Mr. Mohammed.
Sorry, but I have a small note. It's worth to noting that we have an old mental health law in Sudan, which is the Mental Health Law Act at 2011. But unfortunately is neglected and not activated. I hope you read it, as it is a very good start. So I think that if work is not done to approve legalization and civil work in field of mental health, then the next period will witness an increase in number of mental ill patients and those suffering from behavioral and neurological disorders, which will lead to an increase in disease-specific complications such as associated crimes and threats to social safety. This is the core of that act. Maybe if we read it, we can establish a good view to improve the mental health in Sudan.
Thank you, Mohammed. Yes, we talk about this, about the legalization or about the laws, the reform of the laws. The law is quite old. It needs revision. Unfortunately, we don't have a parliament right now. And, the mental health problem is not on the urgent agenda. So I think here we can, like experts, work on improving this law and propose it to the government, to the transitional government, or to the next parliament, which we hope that it will be established soon.
Yes. Anybody has
Or-
anything else to add on? Akshay, Soumya, Soma ma'am, Tanvi.
Yeah, firstly, thank you so much, sir, for being here today and for taking part in this discussion. Um, I could think of three main points in which ways in which world leaders for mental health could help. One could be perhaps drafting an actual mental health policy for the country, and of course, iterations can be made because that will then be passed on to current world leaders or ex-world leaders in Sudan, and they have a enhanced understanding of the geographical complexities of Sudan. So they might be able to refine that policy draft that we could potentially make for you. Additionally, we would be happy to train psychiatrists as well. If there's a proper body which oversees psychiatry in Sudan, I'm not sure if it exists. We may have to individually contact psychiatrists and invite them for a session where it's not that we who will be giving the training, we'll in fact identify professionals that we've come across who have 20, 30 years of experience in psychiatry and specifically in emergency intervention, because with the terrorism threats and the law and order threats that the Sudanese population faces, emergency intervention is actually key. And we know quite a few people working in that space for the past 20 years or so. Other than that, I was thinking we could also potentially consider developing a sample curriculum for what psychology as an educational degree should include. It even the understanding of the word psychology, which needs to be ingrained amongst the public, and not just counseling or psychiatry, but until they understand what psychology is truly about, it'll be impossible for any individual to ever consult a psychiatrist. So perhaps if there's an institution where you do have a senior contact, which would be open to the idea of maybe a BA in psychology, and we could assist, but perhaps with the curriculum development for that specific program, based on insights from a country like ours, which has also seen conflict in the past, and we've come out of that conflict in a manner which has been very beneficial for the citizens, at least. So that could be another potential way to approach the educational aspect that we have been discussing. Other than that, we'll of course send you everything that's been discussed today. And I think these two drafts are the best way forward, and then we can consider the possibility of a training.
Yes, so I think the training part, obviously, we said before that if we can train people from the Ministry of Health or senior experts who Sir knows. Sample curriculum, yes, that's a good idea. And I have already designed one sample curriculum, which is there on the website of psychology. You can have a look at it. If you want, and we can send you the course curriculum of psychology. Drafting mental health policy would be very helpful. The reason being, I have actually assisted in drafting the mental health policy in Kenya. Just 3-4 years back, they were getting revised. So I have samples of that also. And Adil sir, we can definitely look forward for that area when the new parliament comes into being. Till that time, you will have our recommendations, and let's take a step forward. So that's a good idea. Anything else you want to conclude with? Soma ma'am, I have your document. I will put it into the pointers of suggestions.
Yeah.
I will share it on the WhatsApp group, and I will share it to sir also, and I will share it to other world leaders also, and to the board of advisors, so that everybody knows what we have spoken today. And sir, we will wait for your feedback after you read this recommendation, and we will start moving from there.
Okay, that's great. I would like also to thank you very much as an organization, and also the staff for the good work which have been done. And I think we can make a good benefit of our research, our recommendations, and hopefully, the mental health situation in Sudan will improve. The situation is looking very critical, but we have the hope, And I think the hope is one of the elements which is good in mental health, that the situation would improve. And really appreciate very high your efforts, your hard work for mental health healing, and your efforts for Sudan. Thank you very much.